Hi, good day. I'm Jaydon Silorio.
I am Cris Caballes.
I'm Lagarde.
I am John Carlos Hisoler.
And I am Angelina Ada, and we are going to talk about the proper usage of the lead markers.
Lead markers, also known as X-ray markers or anatomical side markers, are used to mark X-ray films. They are used on radiographic images to determine anatomical side of the body, date of the procedure, and may include patient's name.
The purpose of a lead marker is to mark an X-ray. You will commonly find markers in left and right letter options to clearly identify each side of the patient's body. By labeling the left and right during an X-ray, it can prevent future mistakes and confusion.
A right marker is often used in AP and PA projections that encompass both the right and the left sides of the body, such as the head, the spine, the chest, the abdomen, and the pelvis.
For lateral projections of the head and trunk like head, spine, chest, abdomen, and pelvis. Always mark the side closest to the image receptor. For example, if the left side is closest, use a left marker. The marker is typically placed anterior to the anatomy.
For oblique projections, if both the right and left side of the body are included, like spine, chest, and abdomen, the side down or nearest the image receptor is typically marked. For example, left lateral decubitus. Right mark is shown. For a right posterior oblique or the RPO position, mark the right side.
Decubitus positions of the chest projection. The right and left marker should always be placed on the side up, opposite the laid on, and away from the anatomy of interest.
Lead markers generally serve as a way to indicate the left-right orientation of the subject of the X-ray, as well as other important details such as body position, time of procedure, and the initials of the radiographer performing the X-ray. The marker should never obscure any part of the patient's anatomy. These can interfere with the medical legal validity of the X-rays, possibly with the medical assessment of the image. All identifying information should be clearly legible and not overlap with any other markers. It is also absolutely essential that you double-check to make sure that patient information is accurate, since X-rays with incorrect information will need to be redone with the correct information. Markers should be placed along the edge of the primary beam or collimation border. This is generally the ideal placement for markers, since it has the least chance of interfering with the primary image, as the subject of the X-ray should be centered in the frame.